Good afternoon, everyone. Thank you for inviting me to this BRACE conference. Mark gave me the challenge of talking to you today about what does dementia look like to a robot. So before I start, just a little bit, the Bristol Robotics Lab, we're one of the largest groups for multidisciplinary research in the UK. And we are a collaboration between the University of the West of England and the University of Bristol. Our research covers a diverse range of application domains, from bioenergy to nuclear decommissioning, driverless cars, and my area, which is assisted living. And as part of our work in developing technology for these areas, we have expertise in teleoperation, evolving robots, machine vision to be able to recognize the scene in which the robot is operating in. We also specialize in human-robot interaction. How do people and robots interact in different contexts? And neurorobotics, drawing on our understanding of how other organisms function in the real world. So I'm going to be talking to you about our research in assisted living, particularly about the different types of robots that we have, focusing on one specific one as an example for you, so that we can see where the possibilities lie for a robot to support somebody with dementia. So before I start, I'm going to tell you about what we define as a robot. A robot as an autonomous system that is able to operate of its own volition in a physical world. So this is where a robot is different from a system such as a digital assistant, such as Alexa, because a robot will be able to sense its environment, so understand what's around, who's around, where it is, what the terrain is like, what the light conditions are, etc. And then based on that particular scene or context, to be able to decide what needs to happen. And then be able to act out some specific goals given that particular contextual situation. Now, what's important here is that the robot will be constantly sensing, deciding what to do, and adapting its behavior. So a very simple model that is used to describe this is the sense, plan, act model. So I'm going to use the example of the Pepper robot. The Pepper robot from SoftBank is a socially assistive robot. Now, it's a socially assistive robot because it can communicate and interact with a person at a social level, but it doesn't have the ability, even though you see on the screen here, it's got 2 arms and hands. It can't actually do anything physical to help somebody. It can wave at you and be able to do a little dance. So in order to be able to sense the world, a platform like this, like Pepper, has got 2D and 3D cameras. So it can look at depth information, it can look at visual information around it, which enables it to recognize faces, recognize people, also be able to recognize emotions, not in the same way you and I recognize emotions, a more basic and rudimentary way. It can become more sophisticated in recognizing emotions when you combine facial expression data, for instance, with other physiological data. And of course, from the facial recognition, and if it's got adequate and appropriate training data, it'll be able to also get an estimate of age and gender, although I don't think I would like to trust it to tell me what my age is. It's got microphones so that it can hear sounds in the surroundings, be able to detect where that sound is coming from. So it's got directional microphones. It can recognize speech, and it can also recognize emotion in speech. Of course, I say it can recognize. What I mean is that we have given it adequate amounts of data, training data to be able to have exemplars of different instances, different types of emotions in different situations, so that it can perform to a certain level of accuracy. But I have to tell you at the outset, we are a long way away from where this can happen reliably. So lots of work for us to be done. The robot's also got touch sensors. So the surface of the robot in certain areas has got capacitive sensing, so that if you're touching it, stroking it, patting it, it'll be able to pick that up. And this allows for physical interaction with the robot. And you can also use that. So there's a sensor on the top of the head of the robot where it can be tapped, and that can be also used to trigger behaviors. The robot also needs to be able to act and be able to provide information, and it can do this through, in this case, a touch screen on the front, where it can show images or text information. And this particular robot's got a wheeled base. It's got laser scanners, and it's also got another camera on the base, which allows it to navigate around the environment. In order to navigate, again, it's continuously sensing so that it knows when to stop, what to move around, objects that might be in its vicinity. And where we want to get to with these robots is to be able to provide assistance in different situations. So if you look at the red arrow at the bottom of the screen, that's a continuum showing the level of assistance that might be required to support somebody to live independently at different frailty levels. So we use the clinical frailty scale. So starting from low on the left to high physical assistance that might be needed. And then the green line going across the screen is a representation, if you like, of the physicality of the interaction. So at any stage, people can benefit with social interaction. So something to be able to ask questions of, or to receive information from, to be I won't say discuss things, to find out about things, facts and information. People are working on chatbots that can engage in conversations that appear to be like human-human conversations. But robot can also offer cognitive support, and that would be needed as people require more assistance with things like medication reminders, or reminders to eat nutritious meals, or maybe appointments with doctors, etc., or time for you to do some exercise. And then at higher frailty levels, providing assistance for physical tasks. And then you have robots that can actually assist somebody physically. So on the screen, I've put some examples of such robots. So the ParaSeal robot you might have come across before, that's used for people with high levels of dementia. The stroking action can help to relax and make people feel more at ease when they're anxious. You've got the new Miro platform that can link to smart home sensors and can also provide a bit of information. So I've put it up slightly higher up the scale for cognitive support. Then you've got the Pepper robot I just introduced. The Tiago robot's a mobile platform. It's got an arm that can actually carry stuff around for you. And then the Leo one, which is really dedicated for providing assistance with physical tasks, bringing you things, maybe playing with you, tossing things to you. I don't think it's very good at catching though. And then the robots for physical assistance. So the Leo Walker robot, or one that we've been developing in the Bristol Robotics lab ourselves. So what does dementia look like to a robot? So I pulled out this table, which has the different types of diseases that cause dementia, which I think quite a few of you at this conference would already be familiar with. What we're interested in as engineers are the symptoms. So what do these different conditions present at? What will be happening to the person that will be able to be communicated to the robot? So for us, the next step is to understand what could robots do. So in the first instance, they could be used for detecting and diagnosing and assessing changing conditions, so changes in ability to be able to speak clearly. They could help with disorientation and confusion, or problems with memory by helping people manage and assist and support daily living. They could use to preempt problems, so intervene early when it is detected that changes are happening. And they can help with supporting communication between and collaboration with carers, as acting as a intermediary. So how does this happen? How are we looking at sensing change? So I've pulled out some specific examples. So for instance, if we were monitoring people's actions in the home as they went about doing their daily routine activities or attempting to do their daily activities, we might be able to pick up things like confusion and disorientation, for instance, if we were able to detect people entering a room several times, going back out again, opening and closing drawers, or maybe moving slower than they used to. Or perhaps if we could detect they were having problems with balance as they stood or stood up from a seated position, or were standing for a while and started to have issues with maintaining balance. Or we could also look at when they were interacting with different people, or maybe with the robot itself, through looking at changes in emotion, looking at understanding and assessing whether their speech was changing in any way, if they were having difficulty concentrating. So while the robot was interacting with the person, they were sort of looking around or not really focusing. With the sensors that are available, we can pick these signs of dementia up. We can look at comparing differences in these issues over a period of time. We also have been using a combination of smart home sensors, where we get off-the-shelf, currently available sensors placed in strategic locations around the person's home to be able to recognize actions and interactions during simple activities or complex activities. So here, we're not expecting them to be interacting with a robot. These sensors are in the environment, and then they're able to pick up what's going on. And then what we're doing, going to the next step, is that we are taking these sensors external to the robot and combining them. So for instance, here you can see in the image, we've got a contact sensor placed strategically on a drawer. And this information can be collected over a period of time and shared with the carer. And this is quite starting to become quite standard practice in telehealth monitoring, where over a period of time, you can build up a model of the person. Now, what we're doing is we're combining all of this data with information that the robot collects itself and is able to sense at any given time, to be able to then offer support that is contextually relevant and appropriate. So what we're doing is we are developing robots with this contextual intelligence, as I call it, and something that can then learn and adapt to the changing needs of the user. What we're doing is we're using machine learning techniques, artificial intelligence, for being able to track user activity from data that's not been labeled. So this is data that's collected over a period of months, over a period of years. And what we're able to do using these algorithms is track changes over a period of time, with the artificial intelligence system learning this information automatically. So here you will see, this is a plot of days in the week over a full year period, with P1, P2, P3, and P4 being quarters in the year. And then we look at, on the right here, just Mondays. So Mondays over an 18-week period. And what we can see here, sorry, 26-week period, I can't count. What we see here is a drift in activities over time. And while we might not be able to say exactly what's happening, this can serve as an early way for a carer or a clinician to be able to intervene. And then for the real-time support, we can also look at information as a person is completing an activity to be able to preempt what should happen next based on historical data. And then if it doesn't, if the next step doesn't happen to be the kettle being turned on, we can either offer support to the person by asking them or prompting them, or we can use that data for further diagnosis of how their condition might be changing. What we are also looking at is, particularly during the lockdown, I've been working with Extra Care Charitable Trust using telepresence robots. So being able to combine the data that's collected by smart home sensors and integrating that together with information from information about the person, their healthcare records, where then a carer can offer more specific help as and when needed. So what we are working towards is a connected care ecosystem where we're bringing together not just robots that can sense what's happening and changing with the person with dementia, as I showed you earlier, but combining together smart home sensors, personal healthcare records, and wearable sensors to be able to give a more clear picture and understanding of the person's particular needs and conditions relating to dementia, their symptoms, but also track these over time. And in doing this, we've been working to develop, this has been part of another project, a driverless cars project, which also falls under autonomous systems research, where we're developing a standardized assessment framework to be able to have an objective set of assessment criteria, which could then be used by an intelligence system incorporated into an assistive robot or into other devices, other digital assistants, so that we are able to understand how people's, for instance here, level of mobility or frailty, or their cognitive ability, or other individual differences are changing over time. So that's where I'm going to end. If you want to find out more about the research that we're doing at the Bristol Robotics Lab, please do get in touch. Visit our website where you'll be able to get more information and a little bit more about the future of this technology can be found in our white paper, Robotics in Social Care. Thank you. I hope you found this short talk interesting. Please do get in touch if you would like some more information. Thank you.
Praminda, it's been absolutely fascinating. Professor Praminda Caleb-Solly from Bristol Robotics Lab.